Recording in progress.
Morning, Michelle. Good morning, honorable members. Good morning to the supporting staff of the committee. Michelle, I don't think we can start because we are not yet a quorum, if you can correct me.
Good morning, Chairperson. Good morning, members and colleagues. Yes, Chair, we are not a quorum at the moment, but maybe we should give members a minute or two, Chair.
Yes, we will give them 3 minutes. Thank you. Once again, good morning, honorable members. I see we are quorum now, so we can start. Marcia, can you please flag the agenda?
Morning, Chairperson. Everybody, I'll do so, Chair.
First and foremost, I just want to welcome our new members of the committee, Honorable Machubeni, Honorable Kennedy, as well as Honorable Mashlongo. Welcome to the committee, and we know we will work good together. Honorable members, honorable members.
Chairperson, your signal is very bad.
Good morning, honorable members. Can we hear me?
We can hear you now,
Honorable
Chairperson.
members. Thank you, Marcel. Honorable members, we are now at the adoption of the agenda. Can I get a mover for the adoption of the agenda? Honorable Adriaanse.
Good morning, Honorable Chairperson. I move to adopt the agenda.
Thank you, Honorable Adriaanse. Honorable Makwele.
No. Good morning, Chairperson. Morning, honorable members. I move to support Honorable Adrianse on the adoption of the agenda. Thank you.
Thank you, Honorable Makwele. The agenda is duly adopted. Honorable members, now at the agenda point of the apologies. Michelle, can you please indicate which apologies you... Sorry, honorable members. I'm at a venue where the network is not that good, but I have changed gadgets. So we are now at the apologies. Can I get a mover for... Marcel, can you please indicate the apologies?
Chairperson, we've received an apology from Honorable Duplessis. She's currently abroad. That is it. Thank you, Chair.
Thank you very much, Marcel. Honorable members, there's an apology of Honorable Duplessis. Can I get a mover? Honorable Adriaanse.
I move to adopt the apologies. Thank you, Chairperson.
Thank you, Honorable Adriaanse. Can I get Honorable Makwele? Can I get a seconder?
No, Chair. I was also seconding. Thank you.
Thank you very much, Honorable Makwele. Honorable members, we are now at the on the third point of the agenda, and that is our program for the committee. It's in front of us. The only one change that is on the agenda, on the program, is that one of the NCOP Oversight Week. It's going to take place from the 21st to the 24th, and we are going to the Eastern Cape with the Select Committee on Education, and ours will be then on the 10th to the 14th of November. That one we will go to the Northern Cape. So that is the only change in the program. So, honorable members, can I get a mover for the adoption of the program? Honorable Makwele, Honorable Breed.
No. Thanks very much, Chairperson. Without much ado, let me accept the changes on the program, also that they've also given us the reason why we are swapping our oversight committee, our oversight with the one for education, because they by this time on the 10th and the 14th they will be busy with the exam. So that is why we have to exchange, but without wasting a lot of time, as they've explained for us why do they change. I supported the changes. That let's move with the changes as presented before us. Thank you very much, Chairperson.
Thank you very much, Wop. Honorable Breed, over to you.
Thank you, Honourable Chairperson. Chairperson, I second the changes and the approval of the, what do you call it, the program. Thanks.
Thank you, Honorable Breed. We are now at the agenda point of the consideration and adoption of our last committee minutes. Marcel, can you please flag it? Honorable members, we have received the minutes and we have gone through it. Can I get a mover for the adoption of the minutes? Honorable Fanny.
Oh, good morning, Chair. Good morning, honorable members. I'm moving for the adoption of the minutes.
Thank you, Honorable Fanny. Honorable Makwele.
Thanks very much, our Chair. I rise to support Honorable Fanny that this is the true reflection of what transpired on the set date of this minutes. Thanks very much.
Thank you, Honorable Makwele. The minutes is duly adopted. So we move now to the consideration and adoption of the Committee and Oversight Report of the Eastern Cape Province. Honorable members, is there maybe amendments in terms of this report? Okay, or can we second it? Or can we adopt it? Honorable Makwele.
No, Chairperson. I suggest that we support it, but maybe I've got a proposal. If you'll agree with me, that maybe just even though we went through the report, all of us, if let's say we can just flag it, if maybe there is somebody who can just even 3 minutes talk to it, so that just to recap, we without saying that we want somebody to read it as it is, just to recap and just talk to it a bit, then we can then. But from my side, I went through it. I'm happy that it represents what we have seen in the Eastern Cape and what we have observed. Thank you.
Thank you, Honorable Makwele. I also support your proposal, but Honorable Adriaanse.
Honourable Chairperson, yes, we can have a high-level overview of this, but I want to second the adoption of this report because it's a fair review and report on what transpired there. And I was actually motivated by the improvement that has already taken place there. And but there's a lot still to be done. So I want to second the adoption of this report. Thank you.
Thank you, Honorable Adriaanse. I will request Tabile just to give us an overview in terms of the report. Just summarize it, Tabile. Thank you.
Good morning, Chairperson and members. So in summary of the report, as the cover page indicates, we visited the Eastern Cape Province, particularly Gqeberha, previously known as Port Elizabeth, between the 8th and 10th of September this year. This was following a report that was referred to the National Council of Provinces in relation to an investigation that the Public Protector of South Africa had done at Doranginza Hospital, Doranginza Regional Hospital. So the purpose of the oversight visit was for the committee to assess the allegations of improper misconduct and maladministration at the Doranginza Regional Hospital, and to basically ascertain the progress of the implementation of the Public Protector's remedial action as referred in the report. as indicated, the report was referred to the NCOP and it was tabled in the ATC, I think on the 6th of June this year, with the notion that the NCOP should hold a debate on this issue. When the committee was briefed on this issue, the committee decided that it would be useful for the committee to visit and see the progress before holding the debate on this particular issue. So that's what happened, basically. So when we went to Gqeberha, we visited not only Dorangenza Hospital, we also visited Livingston Hospital, Mpilweni Hospital, as well as the Port Elizabeth Provincial Hospital. So we visited 4 sites. Some of the things that we wanted to look at were things like the kitchen, the laundry, the security services, the issues in relation to the organogram, the maternity ward, medical equipment and staffing. And whilst we were there, we also had an opportunity as a committee to engage with other stakeholders, including unions that represent the employees, the various employees from the hospitals or the health facilities in the Eastern Cape. We met with the MSC, we met with the head of department and other officials as well. And maybe just to go to the last 2 pages, some of the things that we found or that the committee resolved on was that the union should submit a written report of the challenges that they have. And also that the shortage of equipment, which hampers the delivery of optimal health facilities, should receive priority from the Eastern Cape Department of Health. The Eastern Cape Department of Health should ensure that there is sufficient non-clinical staff at the hospitals. This includes porters, security personnel, cooks, and cleaning staff, and not mainly focus on clinical staff in terms of filling the organogram. The appointment of clinical staff should also include auxiliary healthcare services such as dietetics, therapeutics, diagnostic, and support personnel. So that includes the physiotherapists, the dietitians, etc., and not only focus on medical doctors and nurses. And that the Eastern Cape Department of Health should improve the infrastructure maintenance at the hospitals. This includes ensuring that wards have adequate lighting. And lastly, that the Eastern Cape Department of Health should submit a detailed plan with clear timelines of the remedial action to the Public Protector report within 10 working days of receiving this report. And then if we go to the conclusion, the committee deliberated and concluded that in the main, the following elements are crucial in strengthening the projects visited. That is comprehensive monitoring and reporting of progress. Laundry and kitchen services should be prioritized. The implementation of a security system is necessary. And lastly, filling clinical and non-clinical posts would enhance healthcare provision and could strengthen staff rapport. This was one of the major issues. I think I'll stop there, Chair. Thank you.
Thank you, Tabile. So we have now duly adopted the report, but I will request Marcel and the team, can you please, at the next meeting, also have that report of the unions available so that we can, as a committee, decide what is the way forward on that report. Is there any issues or questions of clarity from the committee members? I don't see any hands, so the report is adopted then. So we will move now, I think the last one, Marcel, on the agenda. Let me just check.
Thank you, Chair. In fact, Chair, that was our last item on the agenda, unless there is any other business. Thank you, Chair.
No, thank you, Marcel. So, honorable members, thank you very much for availing yourself. And for the new honorable members, this is how we are doing things in the committee. We don't waste any time. We just went straight to the point. So thank you very much, honorable members, as well as the support staff. We really appreciate your efforts. So this meeting stands adjourned.
Thank you, Honourable Chairperson. Have a
Thank you,
blessed
Chair.
day.
Goodbye, colleagues.
Thank you so much. Have a blessed day.
You too. Bye.
Okay, thank you, members. Bye.